and no one is around it.
All right, yes, sir. We are back. Daybreak Show, Rock City 101.9 FM Citizens Forum. This morning, it will be week 2 of that strike action at all Federal Health Institute. Interestingly, those of them that we have here in Ogun State remains the biggest health unit here in the state. It's supposed to be tertiary healthcare unit, but it's the biggest, taking care of so many patients, so many of those who need that care from different places across the state. Is a referral center. It appears end to the strike is not in sight at all. Chienye will give you what details of what I mean by that, because all the parties involved appears to be working at cross purpose, not ready to talk to each other. We just also hope that before the end of the program, we'll get the Honorable Minister of Labour, Chris Ngige. If he agrees to step out of the meeting in which he is, he will spare about 5 minutes with us. Meanwhile, we have our reporters there at the FMC and that road. They'll be updating us with what is happening there. I'm sure Taiwo Fabajo is on. Good morning, Taiwo.
Yeah, Dele, good morning once again. Presently, I'm in front of Abeokuta Grammar, very close to Abeokuta Grammar. Before I move back to the Federal Medical Center, but there is a situation right now on the road. We have a truck carrying a lot of food. It fell on the side of the road, and we have so many. They are trying to do it now. The car actually developed a fall, and it's a rickety car. So it developed a cold too. I'm trying to evacuate the log of food. So we have a little traffic, but the men of the Ogun State traffic control and enforcement corps are on the ground. The police are also there, and the men of the people NSCTC, they are also here trying to ensure that we have a smooth evacuation of the log of food.
All right. Do we have any casualty? Maybe
No.
if it affects other cars, or we have some people who probably.
Not at all. Not at all.
Okay.
No casualty. But everything is going on.
All right. Taiwo, you said you are not in the hospital yet?
Yeah, I'm very close. So
Okay, then don't worry. Let's get in touch with the others. We'll come back to you as soon as you have your report for us. Thank you. Taiwo, in the meantime, Chienye, you have some things to tell us?
Yes, indeed, I do have something. Okay, in as much as patients are groaning towards the strike action, yes, I have. The federal government says it has set up a committee to review the technical and financial related aspects of the demands.
All right. Yes, we are still on trying to monitor the strike situation there. Report is that it's been completely, so to say, shut down because the joint health sector union is made up of all other workforce aside from the doctors in the hospital. Those are the group. So the nurses, the laboratory engineers, the all other group of people who works in the hospital, make of that JOHESU, whatever is called. I'm sure, Jen, you have also given the reaction of the JOHESU. They've said there's no fresh thing really to discuss about. So it's a cat and mouse thing, so to say. We'll take this short break again. We'll be back. All right, we're sorry about that. We're trying to do these connections here and there, Abuja and all the other places. All right, Sheyi Padiola is also online. Good morning, Sheyi.
Hello, good morning, Dele.
All right, where are you, Sheyi?
At the FMC, Abeokuta. Presently at the surgical emergency accident department, so that's Ghana Chienye emergency section of the hospital.
All right. So give us the situation there.
The station still remains just as it has been for days. all the beds now look empty. Just only in the surgical emergency and accident department that we just have just three inpatients that we see out there. Currently they are sleeping, and even the one that is awake is not willing to pray. If it's any emergency, no doctor on site. Even the only thing that is going on within the the section of the hospital is the painting of the department.
Painting.
Yes.
Okay. Who is doing that?
And you have some painters there.
Okay.
Maybe something like hospital. Just maybe I thought they are just using the opportunity of the site
To do the painting. Okay. Sheyi, first, before I go to the number of beds that we have there, you told us only one person is in there. Have you been to that place before now? Can you tell us how it normally on the good working day looks like?
On a good working day where we have a lot of vehicle and human movement, even all these places will be, even this, especially this department that will hardly find a place even to work freely. But here, every started all the offices within and some section like a laboratory and pay points under lock and key. Even the doctors, I think they stopped they are admitting
Patients. Okay, so they've stopped that. But I think that the doctors, the medical group says they are not part of that strike action. So why do you think they are not at work?
I said that because this section is a big, very big one. Anybody who has said FMC before, that you saw the point, the where you also usually find the doctor. They are nowhere to be found. I just left that emergency section of the surgical emergency and accident section. So, doctor, I'm in front of the gynae.
The gynae
So,
unit.
doctor, I'm moving towards the postnatal department now. Present in front of the postnatal department. No, on site. The bed, not even nothing mother on the bed.
All right.
So, and started.
Okay, thank you, Sheyi. You do this for us. Let's get the number of beds that are empty in there. We'll come back to you. I'm sure you are monitoring. Let's get Modena, wherever she is in there too, to give us a report. We will also try and get into Arrow, the psychiatric hospital, to also get the situation. We'll get Modena to give us our report. And of course, Taiwo Fabajo is also within that area. He will also give us the report. And say you are. Yes, Citizens Forum, Daybreak Show. 0809868734 and 090914699670 remains our telephone numbers.
And for the short code dial 321208 it is. First you type rock, then you leave a space. Type your message, include your name, and forward it to 32120. For the Twitter handle, just tweet at Rock City FM. The Facebook fan page, Rock City 101.9 FM. Now is the time for you to share your experience, how the strike affects you as a person. Okay, dial the studio lines now 0809-868-7344 or 0909-146-9670. Okay, while we wait for our reporter. Hello. Hello, good morning.
Good morning.
Good morning.
Dele, my name is Olushola Johnson. Thank you. Yeah, thank you for allowing me. What I want to say first and foremost is, look, let everybody that is concerned think first about Nigeria and Nigerians. Let them shift their sword, go to the round table, talk, so that we can get this country move ahead. Strike today, strike tomorrow does not pay anybody, but it rather causes human life. The doctors, medical doctors should not interfere with what this JOHESU is requesting for. They should not interfere at all. If they have their own problem, they should go ahead and find a solution to it. Thank you. Good morning.
All right.
Thank you very much.
Olushola Johnson. Hello, Modinat.
Oh, we lost her.
Okay. All right. We are still also trying to get the minister. The phone is ringing. Hopefully, we will get in touch. Hello, good morning.
Hello, we have you. Good morning. Hello.
0909146967. You can also join us using the Twitter handle at Rock City FM, or you send it your message, your contribution via the short code 32120.
We have a caller.
Okay.
Hello.
Hello, morning.
Good morning to you.
Good morning.
What really, Mr. Alexi learning from Kuto, what really baffles me is that why is it now that the federal government is reviewing the demand of these adjustments of our governance and leaders as well? Unfortunately, these people, the doctors are now saying they are not in the. Stop me moving inside the what they call the section of the hospital. I walked in the hospital with nobody to check to stop me to ask me what I want to do. I can see the three.
Okay, Taiwo, just hold on. I think we have Sheyi on the line so that you can also listen to Sheyi. Hello, Sheyi. Hello, Sheyi. All right, don't worry, Taiwo. Can you continue with your report, please?
All right, so like I was saying, we have 20 beds here, and we only have 3 kids that are under being admitted there, but there is nobody to attend to them. A doctor just came in to check them to see how they are faring, and after checking them, he left to check other wards. And like I said the other time, maybe I should describe it as a public holiday at the Federal Medical Center here, because cars, you have very limited cars, very limited people walking all around, empty beds here and there, checking all other wards, the antenatal, the hospital, other wards. We have very limited people here. But we had someone here who is one of the kids that has been admitted here. She's an aged woman, and she would like to talk and tell us her experience.
All right, that's good, Taiwo. Can we have her on?
Yeah, she's on.
All right, good morning, ma.
Good morning, sir.
Okay, thanks for joining us on Rock City 101.9 FM. Your name, ma?
My name is Adija Supra Akitoye.
Okay, where are you right now?
I do for hospital and emergency room.
Okay, what did carry you go there? Why are you there? What do you go do there?
My child.
Ṣé gbọ́ Yorùbá mà? Okay, kí lẹ lọ ṣe ń bẹ̀ ta lẹ gbé lọ bẹ̀?
Ọmọ mi ló wà níbí, ó wá jẹ́ àwọn ọmọ tó jẹ́ èso ṣẹlẹ̀.
Okay, ǹjọ́ ò lẹ ti débẹ̀?
Ó ti 7 days báyìí, jọ́ta dédé gangan náà strike.
So ṣé ẹ ti wá rí ẹni dá yín lóhùn, ẹ ti rí nọ́ọ̀sì àbí dókítà kankan?
Àyẹ̀ wọ́n ti gbà wọlé, àwọn tí wọ́n dẹ̀ gbé wálẹ̀ yẹn wọ́n gbà wọ́n rárá.
Ṣé wọ́n ń ṣètọ́jú ẹ̀? Ṣé àwọn dókítà àti nọ́ọ̀sì ń ṣètọ́jú àwọn tó ti wà bẹ́ẹ̀?
Dàrúkọ àwọn ìjọba ṣáàbá wa dàrú lórí àwọn ọ̀pọ̀lọpọ̀ náà wọ́n dẹ́pẹ̀ tó máa tọ́jú.
Okay, so ìyẹn ni Ọlọ́run á fún ọmọ yín lálàáfíà mà. Okay, ẹ ṣé mà, Ọlọ́run á fún lókun sí mà. Okay, Modina, good morning.
Good morning.
Okay.
All right, where are you, Modina? And can we have
I'm actually at SMC Java here in Ayodo, and I'm actually at the physiotherapy department.
Okay, what is the situation there?
First, I was at the children's ward, and it was the antenatal ward, and when I got there, I didn't meet any, there was no patient in the ward. I was told that some of them have been discharged, and those with critical conditions were given appointments. So I further went to another department where I saw some of the staff have been attended by some of those doctors, those that were given appointments.
Okay. Have you been able to speak to either anybody working the staff of the hospital there? Did you see any of them?
Yes, I was able to, but they refused to speak on the matter. I don't know
Okay.
why. Yeah.
Oh, can you describe the environment? Because usually I know that's always a busy place in terms of human movement, vehicular movement in the
Yes.
hospital. How is it now?
Well, it's actually low. It's very, very low. Very, very low. Very, very low.
No,
Very, very.
all right.
A few patients and a few resident doctors are around to attend to some of the.
Okay, are the resident doctors attending to the patients?
Yes, yes,
Okay, they
yes.
are.
Some of them are attending to them. Those that were given appointments today.
Okay.
Okay, those that
Okay,
are
those
on
are
appointment,
appointments.
Appointments today, yes.
they are not admitting any new
At
patients.
all, at all, at all, at
Okay.
all.
What about the other health sector workers? Did you see anybody around?
Not at all, not at all. Only the cleaners on ground.
Okay.
Just the cleaners.
All right. We still expect more reports from you, Modinot. We are trying to also get Sheyi. Is
Alright.
Sheyi online? Hello, Sheyi. All right, Sheyi. So, where are you now?
I'm in front of postnatal, neonatal, as well as children and ward.
What?
So,
Okay, so what's happening there?
quickly before I give you what's happening there, I've checked around the emergency unit the other time.
Okay.
We have all close to 100 beds there. So just only 3 that's been presently occupied.
Out of the 100, only 3.
Yes, yes.
Okay.
So the labor, postnatal, labor ward, neonatal ward, as well as children and the antenatal ward. Only few stable patients are already in stable condition that we have there. The antenatal ward don't have any patients there to call at the moment. So the children we have just I think like 2 when I checked the last time. I think there are 2 children there. So that's the situation, and the place also looks fancy. No doctor. I had one of the security there say today they are cleaning. Maybe the doctor already at the clinic. You are trying to come. I will find out why I live there today.
All right. Sheyi, one busy area that I also know, and we want you to also give us report of what is happening there, is those payment centers and the pharmacists in the FCC. You've been there.
So that even those kids are already and to know what is everything. And yes, they don't have any patients and they are not.
Oh, okay. All right, Sheyi. Hello. Okay. We are expecting Taiwo too, Fabajo, wherever he is within the place. We also have somebody at Arrow. We've not been able to get, and of course the telephone number of the Honorable Minister for Labour. He still he's actually told us he will be at a meeting. I just want him to speak directly to you so that we know where it is. But the latest report, at least that we can confirm, is that government is ready, according to them, willing to talk. A committee is up for that. But whether that will give us any result is a separate issue that we cannot give from where we are now. Really. Okay.
We accommodate more calls while we expect our reporters to call back and then give more updates. 0809-868-7344 or 0909-146-9670. Hello? Hello?
All right, we have one of our reporters online. Hello.
Yeah, Dele.
Okay. Yeah, Taiwo.
I'm actually in front of the specialty clinic where we have a lot of people actually.
Where did you say you are?
Specialty.
Okay, specialty.
Yeah, I think for the first time I'm seeing trying to be attended to here, and I can see doctors and people are all around. But I've actually come to realize that most of the cars I've been able to see and the movement I've been able to see are people coming to use the ATM machine.
Oh, I see.
Actually withdraw money. So that is why we can still have this numbers of people moving in around. But one thing that I noticed is I walk in freely, walk out. There's no restriction of it's going to be 4 p.m. before you can see someone or the other person gauge that I can use to check my weight, and there was nobody to stop me, even if I would have wanted to use it. So all these things that, but I'm seeing people at the specialty clinic where they are attending to the aged and some of the young ones all around there.
All right, thank you very much, Taiwo, for those interesting reports. So, it's a deserted, in quotes, please don't quote me. It's a deserted environment, the Federal Medical Center.
Well, he referred to it as a public holiday.
Okay. Let's see if we are still trying to get. Let's see if we can get some of the union leaders, JOHESU, INARO, or FMC, to talk to us. But we return to you. We return to your messages as soon as we get any of them. We will let you have listen to what they want or they have to say.
0809-868-7344 or 0909-146-9670. Yes, just give your contributions and then share. Okay.
All right. Hello, we have somebody on the line. Hello, good morning, madam.
Good morning.
Okay, it's good. We have one of the unionists there to talk to us at the Psychiatric Hospital, Arrow. Am I correct?
Yes, you are.
All right. Can you introduce yourself so that my listeners can know who we are talking to?
Yeah, good morning once again. I am Comrade Mrs. Palano, Omalara, the chairman, National Association of Nigerian Nurses and Midwives, Neuropsychiatric Hospital, Abeokuta, also wearing the cap of the JOHESU chairman in Neuropsychiatric Hospital, Abeokuta.
Okay, are you on strike there in Arrow?
Yes, strike in Arrow, as directed by the National Association by the National Leadership of JOHESU.
So right now, all your members have complied. They are not at work in the hospital?
None of them is at work in the hospital as I'm talking to you now.
Do you have patients there? Those who are attending to in or outpatients?
We have inpatients that we attend to. So also we do have outpatients attend to. And most of the patients that are inpatients have been discharged by the doctors, which we don't think is necessary because they are not on strike. It's the nurses and other workers on strike. The doctors are not on strike, but they have discharged majorly all the patients in our.
Why do you think that happened? If you say it's not necessary, are you not supposed to work hand in gloves or glove in hands at it? So,
ordinarily, we have been working together as a team in Psychiatric Hospital Arrow, but the fact that the other health workers in the hospital under the auspices of JOHESU have been seeking a request from the government for a very long time now, and the government has refused to grant our request as against the way they have been responding to the other party, that is the doctor, the health sector. So that is what has brought us to this level, this level of going on strike in psychiatric, not only psychiatric hospital, all federal health institutions in Nigeria are on strike right now. And the patients are not supposed to be discharged because the doctors are not on strike. They are supposed to be taking care of the patients, while others, because our demands are not being met by the government, we are on strike. That is why we are not on ground. But for the doctors that are not supposed to be on ground, to be taking care of the patients. So the reason why the patients are being discharged, I don't know.
Mrs. Falana, will your union stop anybody who wants to work from doing so?
Anybody has been, if the person is not a member of JOHESU, we don't stop doctors from working, we don't stop non-members from working. It's only the members that are on strike and the MD conniving with the HODs to bring them to work that will do stop from working, because when they are called like that to come to work, they will call us and our HODs are inviting us to come and work by us. So those are the ones back home.
I still don't understand, Mrs. Falana. Why do you think the doctors are sending these people, the patients, away? Why are they not attending to them?
Well, that question is better answered by them because I cannot answer for them. They are not on strike. They are working. They should be attending to their patients. So the reason why they are discharging them, I don't know. We are on strike. We are not asking to discharge the patients. That's all I'm saying. They are supposed to be attending to the patients because they are not on strike.
All right, I thank you, Mrs. Yemisi Falano, the JOHESU chairman, and of course, chairperson of the Nursing Association in the Psychiatric Hospital, Aro, Abeokuta. Thank you for joining. Just stay tuned, monitor. If there is any reason for you to respond or to react to any comment, please, we can call and we'll take your call. We won't be able to take any further call for now because we need to take the 10 o'clock news. We need to take the 10 o'clock news. Again, interestingly, Ogun State, Abeokuta has the two biggest of those specialized hospitals in the state, the Federal Medical Center, Idiaba, and of course the Neuropsychiatric Hospital, the one we simply refer to as Aro, also here in Abeokuta. Stay tuned, the news will come up at 10 o'clock. After that, we will be back. Alright, it's good to know that you are still there listening to Rock City 101.9 FM Citizens Forum. This morning we visited the federal hospitals across the land where the Joint Health Sector Workers Union strike will enter week 2 in a couple of hours. And reports from our reporters indicated that strike is effective, is on at both the FMC and the Neuropsychiatric Hospital here in Abeokuta. We have a senior member of the medical group. You heard reports from Aro in particular saying doctors discharged patients which they were not supposed to do. They are not on strike, that's what they told us, and were supposed to be at work. Therefore, they were not supposed to discharge any patient that come to them. We have a senior member of that group, the Medical Association, former National Secretary of the Union, and yes, Dr. Alayaki. Dr. Alayaki, good morning.
Yeah, good morning, sir.
Dr. Adeomi Alayaki. All right, Dr. Alayaki, there is that allegation that doctors are discharging patients from the wards, particularly at the Neuropsychiatric Hospital.
Well, thank you very much. Actually, I don't work in the Neuropsychiatric Hospital. I want to greet everybody at home. Good morning, listeners. I don't work in Neuropsychiatric Hospital. But from what you from FMC Abeokuta, the patients were still in the hospital and they were being attended to by the doctors. I'm sure those that have been discharged from Neuropsychiatric Hospital, maybe because the doctors there knew that they needed more of nursing care, which was not available. So if they should be kept in the hospital, anything happens. And if it happens that way, they can even be sued. I tell you, this thing is not available, why are you keeping them? I'm sure they charge all the patients on the ward. But they will look at them critically, they will look at everything holistically, that okay, this one we can still manage them. This one we can take them, we have to let them go to a place where they can manage them, where we have other health workers working. For example, health workers working at IJA, have them working at what's it called? So I want to believe that we were not told the gospel truth of what's happening now. Look at what happened in the FMC. You were able to balance that story. You see, if they don't have seen a patient, the center cannot go to the laboratory to await their patients to for medical tests. The center cannot go to pharmacy to attend to them at the pharmacy. So why all these patients will need all this care which are not available, you can discharge them. But those ones you are stable that you can still manage them, they will be there. And that's what happened at FMC. So telling us that that's not the reason why they have to discharge the water. I don't believe that's the truth of what is happening there. But I believe it is not from FMC and from the National Hospital, like the chairman of NMA in the Ogun State, if you ask him, they're able to tell us more. So anywhere where this transaction is going on, I'm sure doctors will not discharge all the patients.
Unfortunately, I read a report that is to the national president of NAM yesterday, saying that it's not like the way that doctors are not discharging patients. That we know that they are not at work and we're managing them. Another report is I don't know if I have it, I read it this morning. So he said that, and this one is now saying that why are we discharging them? So it's this is a contradictory report. For doctors, we have told ourselves that the best we can do is that our patients, we have patient care practice, that we have to care for our patients. And so that we know we can handle with us the kind of other health workers we should handle. For those that we know that we cannot handle with the other health workers, we can respect to where we know we have other health workers working. We have them working at state hospitals, and them working to land to. So why do you have to deny them? Why they can go there to access facilities?
All right, thank you, Dr. Adeomi Alayaki, the immediate past Secretary General of the NMA for a general. I know that the state chairman of the NMA, Dr. Abayomi Olajide, works in that role. Dr. Olajide, we also expect your own reaction to the thing. Interestingly, the JOHESU, the strike action right now, it's supposed to be within the federal establishment, but JOHESU has said from next week, everybody, state, local, government-owned hospitals will be joining from next week. That's, well, I won't say the bad news for now. But that's the news.
Well, right. Hopefully it might not be a bad news. That's if they agree on the negotiation table with the federal government, and then hopefully I hope they will be able to attend to that.
All right, thank you so much. In the meantime, we are still, associate producers are trying frantically to get the minister. In actual fact, we spoke with him again during the break. I just want him to say it to us, talking of Chris Ngige. As soon as that line, as soon as he picks, the phone is ringing. As soon as he picks, we'll put him on through. In the meantime, let's go back to you. Yes, you. What has your experience been so far?
0809-868-7344 or 0909-146-9670. The shortcode dial 32120. Type rock, leave a space, type your message, include your name, and then you send it to 32120. The Twitter handle, keep tweeting at Rock City FM. The Facebook fan page, Rock City 101.9 FM. Hello.
Good morning, my sister and girls.
Good morning.
Good morning, Mr. Dele.
Thank you, sir.
Oh, my name is Olubenga, calling from Bodolubeya in Abeokuta. For the look of it, doctors are not in support of the current strike by JOHESU. So, it is. Hello?
Yes, we can hear you.
Okay. It is what Egwuonwu says, doctors must try to support them. Doctors can't work without nurses, pharmacists, radiographers, etc. Judging from that woman from Aru, she said doctors can continue admitting patients and treat them themselves. My advice is that the federal government should accede to their demands on time so that no life will be lost in due course. God bless us today. God bless Federal Republic of Nigeria.
God bless you too. The shortcode dial is also available 32120. First you type rock, then you leave a space, type your message, include your name, and send it to 32120. Hello, good morning.
Hello, good morning.
Good morning.
I'm calling from Basala. Good morning, Chienye.
Thank you.
How this time will affect me? I think it is unfortunate this strike has ended. One of the problems at the end will be a further distance of already passed as health delivery. How it will affect me in this way. The maternal mortality rate will further get worse. Our people will be tempted to approach different on doctor death end. That expectancy will further get down from the present 52 years it currently stands. Life will further be shipping and so on and so forth. This strike also will affect me. This is because the strike is not people-centered. The strike is not about how to lessen the fees. Patients pay to get healing. In these days that people can no longer afford hospital fees. And if based out by the hospital management will not even have money to transport themselves home, honestly, MD, FMC. It will also affect me also because pediatrics will suffer, that is their children care. And I think infant mortality rate. And also further the vulnerable group will suffer, the pediatrics, that is the aged. Thank you very much.
Thank you too. Hello, good morning. Okay, we lost that call. Hello, 0809-868-7344. Good morning. Hello.
Good morning, Dele. Good morning, my sister.
Thank you.
Please, Honorable Larejaji. Am I on here?
Yes, you are.
Yeah. My name is Honorable Larejaji. I'm calling from the People's Parliament in Abeokuta. Dele, we do not expect the doctors to discharge the patient. They can't handle it alone. In paramedicals, we work hand in hand. It's a teamwork. I mean, we don't go and take the bedpan to go and give to a patient to poo-poo or whatever, or defecate. No. It's only to consult, do surgical operations if possible. So what we are saying is God needs to be very, very sensitive. Unfortunately, it is the poor and the less privileged people in the society that are going to suffer, this strike action of the thing. Doctors don't understand anything except strike in their life. It's very unfortunate. I pity my people in this country. God bless you people over there for having me. Bye-bye.
God bless you too. Hello. Hello.
Hello.
Good morning.
Also, good morning, my sister. Egwuonwu, Mr. Dele.
Oh, thank you.
Ade is calling from.
Okay, Ade, go on.
I want to say that some of our leaders, they are wicked, callous, selfish. Why in terms of people's head? Why even if they will play with any sectors, the head is wet. For the fact that they don't attend hospital their family, that's why. The labor minister that is saying they are setting up which committee they are not sincere. I've not committee they have been setting up all this year. What has been coming up? Make a difference. They won't meet up. So what are they saying? They are wicked people. Therefore, the thing that is getting to us, they are not serious. They are cowards. They not fight for the enticement. Nobody is happy that all this sector go on right. I mean, it affect life. But can you blame them? They have been for years, and government is not being sensitive. What we say for our government, they are wicked people.
Okay.
They want killing us.
Okay, thank you. We got that. Hello.
A doctor friend about what is going on in this track. What the person told me is that the nurses and the physiotherapists are asking for more salaries, like their own salaries. That means if they are doctors and they are trained for 7 years to get a certificate, the nurses will go to nurse to have 2 years or 3 years experience of certificate. You want the same salary with them. I think we should be more proactive in this thing. Look at it from my own basic point.
Do you think that is the correct thing? Have you verified that?
We keep hearing of demand. What is the content of the demand? They are asking for demand. What is the content? Do you know the content?
Of course, the contents are out there, sir. The contents of their demands are out there.
Contents are more or less like salary increment.
Yes.
So why would you pay somebody who has a master degree with somebody who has a PhD the same salary? That's the question. We are not fair to ourselves. We are not fair to the common man on the street. Everybody is very callous in this country, so we should be able to consider it in every demand we are asking for. That's my own submission. Thank you.
Okay, we got your summation. Hello, good morning.
Hello, good morning. Chienye.
Good morning.
Dele, good morning, sir.
Morning, sir.
I am Pastor Shola Makinde calling from Owu Kingdom. Here. Then I want to start my contribution on it by asking you a question. Do we still have a minister in charge of healthcare services in this country?
It's straightforward, we do, as far as I'm concerned.
Okay, all right. Let me go.
Hello.
Okay.
Yeah, good morning.
Good morning. Thank you for joining.
This is Akin Olatubos is speaking from Abeokuta.
All right.
The problem that is going on in next sector is because it is the doctors that is causing it. I don't know why doctors will consider others as irrelevant. I don't know why.
Others are also trained Nigerians. You are trained. So you don't need to protest. They are the one that is protesting. And government was not giving this money to others. I don't know why they want to do superiority in that sector. I don't know. You are also relevant. You cannot do without anybody. Even the country you got without them. So why do you consider them as irrelevant? So the doctors should just behave properly and let the government do whatever they want to do. Because they are involved in politics, they are the ministers, we have them as the ministers, we have them as governors, and we also have them as in every part of the politics. So they are using that, threatening the government. The government must not do it to other sector professionals. I don't know. Good morning.
Okay,
all right, we take more calls. A couple of it, we go back and check the messages.
Hello.
Hello, good morning.
Good morning.
Yes, sir. Good morning.
Yes, my name is Ayodo from Abeokuta. My own side of it is, if I happen to be the president of this country, I will privatize all health institutions in Nigeria and let it run as a private sector. Whether the number of people at the federal medical centers, health institutions, whether all of them will be gainfully employed. Because whatever they do, they consider themselves first. I know that is the nature of human being, irrespective of the number of, irrespective of anybody who want to die. I could remember there was a period that a medical doctor let me just keep the name of the institution. One of the medical doctors was the one that instrumented the strike. Unfortunately, he was attacked in the midnight of during the strike by armed robber. He was rushed to the hospital to FMC, and they have to call some of his colleagues that were equally on strike. They were the ones that saved his life. If it were to the individual who happens not to be a medical doctor, the person would have died that day. Our health sector is another thing entirely. Let me tell you which other sector in this country that is even healthy. But there was a day I went to Federal Medical Center I learned that the consultants were on strike and the doctors refused to work. Even those registrars and other doctors, they said they were in solidarity with their consultants. And number two, how can nurses and other sectors believe that they should earn the same salary or the same salary structure with medical doctors? The length of services are different. If they want to earn the same salary, they should go to 7 years course and they go on consultancy. There's no way no doctors will not be superior at any time. It is possible to now do a nurse as
Thank you, sir. Thank you.
Hello.
Yeah, hello, Mr. Dele. Good morning.
Morning.
Yeah, Chienye, good morning.
Good morning.
Yeah, this is Ayodo. I'm calling from Abeokuta.
Thank you.
The issue of health sector in Nigeria, I think by now you and I know that it's not the issue that just started. That all these so-called big men, politicians, and leaders are the cause of all these problems. The superiority among the doctors and nurses and other health workers, and the facility itself as the politicalized. And if you look at all these things, how many are the leaders are receiving treatment in Nigeria? That is number two. This question go to the doctors. Are they relevant? If they are relevant enough, and if the government, so-called leaders, ministers, senators, and the Mr. President himself have confidence in them, why can't they be receiving treatment in Nigeria are facing what other ordinary man are facing in this country? We have to be very frank to ourselves. You and I know the situation as far back in 2010, 2011. We have the situation now. Opalamba Gwaju, Umolenyon, Sheboju Shiri, Tavinjo, the Roger, the
You too. Okay, we add this call and check the messages and tweets. Hello, good morning.
My name is Anna. I'm calling from Abu.
Could you speak better than this? Good morning.
Okay, I think the issue is about everybody being alive to its responsibility, and everybody doing what is needful, and justice, equity, and fairness need to prevail. People are now commenting. The issue, I believe, it has been on for over 3 years. It has not been addressed. It is either it is postponed. They sit at this meeting today. It cannot be concluded. When it's concluded, it's now led to implementation. Government will be found wanting in implementation. It's only government that can implement what these people are requesting for. Forget about our certificate. Everybody is important in his own quarter. You as journalists, you are very important. You are doing a good job for citizens. Equally, doctors are important in their own realm, and other medical workers are equally important. They should be treated with justice, fairness, and equity. Nobody should be made to be derailed in this regard. Look at it. When people are demanding the person for their own, what should be apportioned to them? What was the response of doctors on media? You read it. We listened to a newspaper review and we heard what they have said. Are we, is that justice? Saying that if other people get what they want from government, it leads to another thing. In a country that all of us belong. And here we are now. And we have had a comment from somebody from Ado saying that they cannot work. They are discharging patients. It means other people that are on their side are important to complement what doctors have to do. In that regard, I think the solution is that government should stop.
You have less than 10 seconds more, sir.
Okay, they should stop playing plans with this issue. They should up and do it in this regard. Good morning, thank you, and God bless.
Okay, thank you, Page. We got the first one from Marayesa Emmanuel Oluwagbemi. The effect of this ongoing downhill is heinous and diabolic because patients are going through hell during this period. Most of the patients that are not fully recovered have been discharged abruptly, all because of the strike. Honorable Ugundi Mohamed Kundayo, health is wealth, so they say. The health of the citizens should be among the priorities of any responsive and responsible government. People whose health demand urgent medical attention will probably be going through series of pain, especially when they cannot afford bills of the private hospitals. Okay, then for the tweets via the Twitter handle, we have a couple of tweets here. Oh, we got this one from Aderoju Victor. Whoever is trying to moot this idea is being unreasonable. I say no to this. Okay, that's for the payment of gratuity. If it should be stopped, that's for the quick takes. Then Zechariah Olubayo Tanigbola. Life is nothing to our leaders in Nigeria. They can say anything during campaign, but to implement what they have promised is a problem. I cannot blame them much because some of us have collected money and so on. Kunle Gab. JOHESU should clear the air on the allocation of enemy, that they're just being competitive, envious of them, please. And there are more tweets here. Abi Fagbemi, when did the strike action in our country, when will it ever be put off? And why is it that our so-called government understands the strike action more than other things? I was wondering, we are the only country facing challenges in the world. If not, why should our so-called leaders refuse to listen to the cry of the masses? Yemi Da Vinci, I am torn between supporting the strike action of JOHESU because I think their demands are justified and being against it, as I know the toll in the lives of Nigerians. I have a friend who has cancer and he's had to move to a more expensive private facility. What Nigeria needs is a state of emergency in our health sector. Everybody talks about Nigerians losing about 2,000 doctors yearly to brain drain. But have we asked how many nurses are leaving, physiotherapists, pharmacists? We need to sit down with all the health sector stakeholders and iron out every issue. Let NMA and JOHESU argue it out in a televised debate, which should be organized by National Assembly Health Committee. Nigerians spend more on wigs than on drugs yearly. We're not funding our health sector well at all. And the money spent on National Assembly members is a start to fund the money. Surakat Ayodo also tweeted, government should do the needful concerning the health sector. A country that could afford to pay a senator 13.5 million naira monthly has no excuse not to accede to the demands of various agencies. Yemi Da Vinci again, Nigerians castigating nurses and other staff of health sector should realize how hazardous their job is. When Ebola and Lassa was killing nurses because of lack of preventive equipment they provide for their family. Surakat Abiodun tweeted, "Our health institution is not well funded. It is high time the government placed much priority on the health of its citizenry and not this show of shame. They are quick in making agreements, but they don't always fulfill their promises." That's from Surakat Abiodun. Okay, the messages, keep them coming in via the shortcode dial 32120 for the Twitter handle, tweet at Rock City FM, the Facebook fan page, Rock City 101.9 FM. Okay, I have more tweets trickling in now. I got this from Ogunoike. "For clarity's sake, no one is saying other health professionals want to earn same salaries with the medical doctors. What we're saying is that other health professionals should also be cared for, not only the physicians work in the hospital." Aderoju Victor, "Why is it that government in Nigeria always allow worker matters to degenerate into strike?" Festus Chienye also tweeted, "The health workers are not requesting for the same pay with doctors, but justice and fairness, because the doctors are not the only ones working in the healthcare, so equity is all JOHESU wants and not equality." Okay, that's a tweet from Festus Chienye. Okay, then we have this one again from Ogunaike. "Why is it that when JOHESU goes on strike, the medical doctors always prevent federal government from implementing their demands? And why do they discharge patients when others go on strike? Are doctors also on strike too?" Those are questions from Ogunaike. Okay, we go back to the calls. 0809-868-7344 or 0909-146-9670.
Good morning, somebody. The radio, can you deal with the radio? Morning. All right, sir. We can't hear you, sir.
Government to have a massive, to have human being. I am giving they want to use our population. People, if people around their own, and want to work them, put our needs in, now it's better than I don't think it's the reason why we are having 4.7 million and Nigerians are not so now this means why they cannot not budget very well. But those people are doing but not developing. But now I said it's a problem to do work and this is all.
Okay, we eventually lost the call. It wasn't clear enough earlier. Hello, good morning.
Hello, good morning.
Good morning.
This is Catherine from Ashore Estate.
Okay, thank you for joining us.
This is quite interesting. It's high time the federal government take the bull by the horn. Nobody is competing with the medical doctors. What will be, and what should be. Now, nurses just are on strike. See how they are discharging patients from the hospital. There is no department that is not important in the health sector, even the cleaner. So whenever any department is fighting or asking anything from federal government, the medical doctor should just keep quiet and be calm. Allow the federal government to do the needful. They are not the ones to dictate what will happen. We are all equal before the law. So the medical doctor should go and sit down. They should not interfere at all in this JOHESU strike.
All right, thank you.
That is the take.
Okay, thank you. Hello, good morning. Hello.
Hello, good morning, Mr. Dele. Good morning.
Thank you for joining us.
My name is Big Daddy from Egwuonwu. Hello, Mr. Dele.
Oh,
Hear you,
you.
can
Go
hear
on.
you.
Yeah, please, I wanted to come and meet you maybe when we start our own strike. Because I wonder, because everybody is important in Nigeria. Buying people without seeing the market people who are not going to eat. See, only the language you understand is right from those government people. I wonder what used to happen. Those people that is black, but to go and sit there and on strike, is it going to? You see, these doctors and other people before they back on strike and back on their work. But it's the masses that suffer this. When will this end? And presidential candidate will come on 2019 to speak and tell every other thing. Hello?
We can hear you, Big Daddy.
If anything, they will promise and sell it. I see last time there are people from Africa. All these my people was already quite long. And that strike are back on again. At the end of this year, they will still back on. When is this thing going to end? Police always to go on strike. Why? And doesn't mean that they pay them more than other people. Like God help us in that. Have a nice day.
You too, Big Daddy.
Hello.
Good morning.
We have an issue with your line. It's Mustafa. The line is so faint.
Hello.
Hello. There is a radio there. Can you switch it off? We can get echo from where you are. All right, Isa Mustafa, you can try again. But
Okay, we lost the call earlier.
Can you hear me now?
Yes, we can.
Okay. I got some things that check the government to have not sector just out of the program and what for the other side. But see, I don't see why they are not everything for now. Then to assist perhaps budget, go on budget, money that can by increasing money from what so that the majority of Nigeria don't have money. 99% don't have money to go and for medical something abroad. See, and we want to for them. You understand that they need to take care of us. Hello, are you hearing me?
you have less than 10 seconds, sir.
And you need to take care of us. But you don't have other ways to go. You don't have other ways. Because
All right, thank you.
My name is Chienye from Ashoyo.
Okay, go on.
The problem in health sector it started long time ago, and it's not a situation whereby the other health workers are trying to compare themselves to the doctor. The federal government needs to do something decisive very fast, and one of those things is to ensure that they harmonize the salary structure in such a way that it will only accommodate for allowances for specific professionals, and also ensure that the safety of everybody within that community is guaranteed. If an health worker knows that the doctor is receiving more than him because of so and so situational job he has to do, nobody will go against them. But a situation whereby you are working as a Nigerian in an health sector and your counterpart in other sectors are receiving more than you, or your counterpart in other sector are getting to director level and you are being stagnated, it's not a good thing. Nobody is a slave to anybody. We all went to the 4 walls of the university and we are all graduates. Go to Middle and Catholic Hospital, you will see a lot of PhD holders in that sector, and they cannot even use their PhD because they will always say that we don't need your PhD, go away, go to university. And the one way or another, because of the nature of that job, there is no way you will not be able to use the knowledge you have acquired as a PhD holder. Whereas the government is paying you for the BSc degree and not your PhD skill. So that is the thing. The salary structure should harmonize.
Thank you.
Thank you very much.
Okay, thank you too. Hello, good morning.
Hello, good morning.
Good morning.
Hello?
We can hear you.
Okay, good morning. I'm Prince Ojo. I'm sitting here in Abeokuta.
Okay.
For these striking health workers, when we all voted for change, it was hoped that things would get better. What is happening now has proved us wrong. I wonder why the government cannot fulfill agreements reached with the health workers. Looters' money, Abacha loot, have been recovered. What are they doing with all this money? I just pray that the present government should their life to accountability. Nigerians are suffering. That's my take. Good morning.
Okay, thank you. We got that. Okay, that will be the last call. Running through the tweets now, I have this very one from Ajayi Yetunde. JOHESU is not fighting for the same salary structure with doctors. Please get your facts right. Then Akorede Camille, federal government should thoroughly examine all agreements and its obligations and call back for honest, sincere renegotiations. There are too many strike actions in Nigeria's public sector and the government should find a solution. Ajayi Yetunde again, in the past, NMA were the ones that went on strike incessantly since their demands have been met and they do not want others to fight for their rights. Ogunoike tweeted again, the doctors should not be spreading propaganda. They are both the cause and the perpetrators of the problem that we are having now that has lingered for years. An employee should not determine the fate and benefit of other employees. Doctors should leave JOHESU to the government. Akorede Camille, for all these strike actions here and there, there's no easy way out because government will always tell you they lack resources to meet its obligations. The healthcare workers are equally essential in the health sector. They complement other tasks. Their demand should be met. Ajayi Yetunde, at this point, I think it's pertinent for Nigerians to know that the current problem in the health sector is caused by the doctors. All what JOHESU is asking for is equity and not equality. Let's be honest. We are being maltreated in the health sector. Festus Sheung, doctors should not determine or dictate what other health professionals earn. Enough is enough because they are not the ones that employed the other health professionals. Everybody is essential in the healthcare delivery. Ajayi Yetunde again, since they claim to be the head, they should be versatile in everything, hence no need to refer or discharge patients to other facilities. Please give them the nursing care, physiotherapy, and psychological care. Ogunoike again, doctors, nurses, pharmacists, and other workers who work as a medical team for effectiveness of care. None of them can work alone. So why will federal government allow doctors only to dictate for them and give them preference? It's injustice and it will amount to further disharmony. Tonat Singh also tweeted, can the doctors do the job alone? If the answer is no, then why are they antagonizing JOHESU's demands? Doctors should shelve their egocentric nature and appreciate the importance of all the professionals in the system. Government should harmonize the health sector workers' salaries. And lastly, from Ogunoike, the public should not be deceived by the word of the doctors. We also have masters and PhD holders among other health professionals too. That is that.
And of course, that will be it for the day. We appreciate everybody who joined us. I'm sure you've learned 1, 2, or 3 lessons from events of today. And to those who are striking, also remember there are some people who are directly feeling the pain. Imagine the grandma who brought her child to the hospital and could not get treatment. Anyway, we'll continue to pray just as we are striving, working to ensure that we have a better Nigeria. Tomorrow, same time, we'll be here with an interesting character. Join us. Dele Ayodo is my name. I say God bless you all. God bless Nigeria and God bless Rock City.